Hi everyone, in this short video, we're going to talk about blood pressure and heart rate. We will start by defining what is a blood pressure. Now, blood is said to move throughout our circulatory system and it is moving under a force or pressure. And most of this pressure is said to be created when the heart contracts. We measure this force of the blood, called blood pressure, through the use of a blood pressure monitor. A cuff is attached to the left arm, right? It will squeeze, right? And the pressure created in this cuff is going to squeeze this artery found in your left arm. And when the pressure in the cuff is slowly released, there's a sensor which is going to detect the blood flow and give a reading for blood pressure. Normal blood pressure is given, normal blood pressure tends to be a certain figure, and this figure is 120 over 80. This figure of 120 over 80 represents something called the systole over the diastole. You can do some research and figure out what should your blood pressure be given your age, weight, and of course, if you're male or female, right? But most adults tend to have a very average blood pressure of around 120 over 80. What you are going to do for me is take down this very short note on what is blood pressure, and it is not necessary to take down the note on the figures which represent blood pressure. All I need you to know is what it is. Let's look at heart rate. And heart rate looks at the number of heartbeats per minute. So this is simply what the heart rate is. You have to take down the definition of what heart rate is. It's also called BPM, beats per minute. And as stated on the screen, it says your heart rate can vary as the body's need for oxygen changes. For example, during exercise or sleep. We are told that the heart rate is measured by finding the pulse of the body. For your purposes, all I need you to know is a definition for heart rate, as well as can you predict how your heart rate will change during exercise? Should it increase or decrease? You can figure this out by doing a simple exercise, which is you're going to go to your wrist, right? You can figure out where your pulse is on your wrist, and you're going to record the number of beats that you can measure in your pulse, maybe in your wrist, and you're going to take note of it in terms of how many beats per minute. That's your resting heart rate. Usually I'd ask you to jog around the class, but as you're home, you can take a little jog around your house. After doing so, you're going to measure the number of beats per minute using your pulse, and you're going to compare the two figures in terms of your resting heart rate and your heart rate after exercise. And you should be able to tell me, does your heart rate increase or decrease after exercise? And this is my short video on blood pressure and heart rate.